Hello, Saptarshi.
Hello, Roman. Nice to meet you.
Nice to meet you, and I'm very glad to introduce you uh, to our community, our homeopathic community. I have to mention that I saw several your clips, videos in YouTube quite long time ago, and I enjoyed them very much. And a few weeks ago, in our academy, we had a lesson about cough, and I wanted to bring as an example your video with cough, and one of our students brought it even before me. So and somebody said it will be very nice to hear from Dr. Banerjee about cough. So I think that it will be very nice for people to know, first of all, who is Dr. Saptarshi Banergea. First, few words, please tell us about yourself.
I'm Dr. Saptarshi Banergea. I was born in Calcutta. I am actually the fifth generation of homeopaths of my family, perhaps the longest serving homeopathic family in the world. My father runs a homeopathic clinic in Essex, London, and I run the homeopathic clinic in Calcutta. So we try to match the best of homeopathy in both the worlds. And to be honest with you, I will have been taught A for aconite and B for belladonna, so I didn't know anything else from my childhood days. So homeopathy has been there since a very early age with me. And it's more like a love and passion for homeopathy, which I have developed over the years.
Great. And I have to mention that we had a very nice and productive conversation before we are recording this video. And we found very, let us say, we found many aspects of possible collaboration. And one of our common passion is acute prescribing. Yeah. So I would like to ask you about your acute prescribing. What do you think is the most important for homeopath to be successful during acute prescribing? And then we will discuss how we can collaborate.
In my talk with you, I shared with you how I run a slum clinic in the Calcutta slums. I visit there about twice or thrice a month, and it's almost like 50 patients with mostly acute prescribing in 3 to 4 hours time. So in a limited time period, doing acute cases is difficult, but what I generally stress on and I generally ask is about the etiology and what are the manifestations with particular symptoms. So if you think of a respiratory issues and with cough, I always ask the patient, and my granddad used to say that if the patient is coughing outside the consulting room, you do not need to call him inside, because you know from the cough sound that you can prescribe the remedy. So obviously I don't have that degree of confidence yet, but listening with the cough sounds, that always helps in prescribing. With acute gastric issues, we ask about the etiology, we ask about what are the modalities. So I do make my prescription based on the etiology, manifestation, modalities. And you understand, to be honest, in a slump environment, it's not possible to do a repertorial analysis in such short time. So I depend on my understanding of Metromedica and comparisons to do the same.
And here my question, are you not afraid about making harm, but acute prescribing from time to time? I mean, when you or we or I or suppress the symptom, or you have a possibility to make a so precise acute prescribing which will not harm?
There are a few factors here. One, I generally ask the patient to take the acute medicine during the acute phase and revert again, so that to prevent the recurrence, so that we can stop the chronic recurrence. A. B, I generally prescribe in a very minimum dose with a single globule, So there are hardly any chances of flare-ups or aggravations with, even in a slum environment. I make sure the patients are having a single dose and a single globule. So in that way, I've seen the aggravations to be very minimal. And we always make sure to ask the patient, please make sure you come back in 2 to 3 weeks time when the acute phase is over, so that we can prevent the recurrence. So that is one of the major things we do counsel the patients about.
Great. And I told you before about our hotline clinic via homeopathica we arranged about 2 years ago, and now it became more and more online clinic, not only for acute as well for chronic diseases as well. But it will be very interesting if we can arrange kind of acute evenings or evenings of acute prescribing to be open for acute prescribing. Let us say we sit together and our homeopaths are there, and we have cases from all around the world just coming, and we can treat not only with therapeutical aims, but with educational aims as well. So this is our view, proposition, how you think we can do it and arrange it.
Yeah, I think, that's a wonderful way, because to be honest with you, my understanding is you can only learn best when you see patients. So, it sometimes it stays with you, a particular case or a particular incident, if you hear that from a patient's own mouth, and it helps you to remember the remedy as well. And with acute prescribing, what I love the most is doing the comparisons. For example, a patient has come to you with a dry cough, and I ask the patient, what's the nature of the cough, and there's a tickling cough. And immediately, I try, when I'm teaching, and I also would like to share that with my friends who will be joining in, the remedies which are coming in my mind, and that is how we'll do the differentiation. So when I'm hearing a tickling cough, I will think of Rumex crispus, I'll think of Coccus cacti, I'll think of Argentum metallicum, and then again differentiate. Is there any mucus? No, I'll think of Rumex. Is there any mucus? Yes, Coccus and Argentum will come up. Can you hawk out the mucus? No, Coccus is the remedy. If I can hawk it out easily, Argentum metallicum. So that's how my thought process goes about, and sharing that with my fellow homeopaths. I think that will help them better understand the remedies, and also while dealing with the patient, you ask the right questions to get those answers as well.
Yeah, great. I think it will be of big interest, such evenings or marathons, let us say. Maybe in the future we can make real acute homeopathic prescribing marathons with several homeopaths, and to treat as much as patients possible, and to give to as much as homeopaths possible to learn, to study, to discuss, to go deeper. What is your experience with this new fashion disease? I don't want to tell the name of it because we will be on YouTube, and they don't permit even to use this word of, you understand what disease I'm talking about, of this modern disease. COVID.
Yeah. To be honest with you, it was difficult in India, especially with the second wave. There were quite a lot of cases where we had difficulties. But to be speaking from the bottom of my heart, patients who have been on constitutional treatment, they hadn't had such complications. And sometimes, cocktail of conventional medicines has disrupted patients' way of recovery. For example, in India, especially in the second wave in April and May, we had patients who are down with black fungus, mucormycosis, and that was a result of heavy influx of steroids. And group of diabetic patients who have been under homeopath's treatment, they had recovered better because they didn't have the cocktail of chemicals and immunosuppressants. So I feel it sometimes occurs with the conventional treatment and conventional medicines, which led to so many deaths, especially in my country at that point of time. A and B, with everything shutting down, people did not have access to healthcare as well. So that was, I feel, one of the predominant factors resulting in India's death rate at that point of time. But since then, patients who have that symptoms and those manifestations, we have had good results with homeopathy and not had flare-ups or progressing to hospital admissions. So that's my experience, I feel, which has helped with regular homeopathic treatment.
And what is the situation now in India with this?
It's more in the endemic stage. We are getting very few patients, but people do not want to get it tested. But sometimes it's symptoms like common cold, so we're treating like that as well, without causing panic to the patients.
Yeah, it will be the same remedy. I mean, the same prescription, or arsenicum album or belladonna, or even small remedy. But anyhow, it will be prescribed.
Like with every generation, its new name of the disease comes up. But if you look back, the manifestations, the symptom picture is always the same. So we make the patients panic with the name of the disease. But if we treat with symptom picture, I think we can go about it at ease.
Tell me, please. I wonder, in difficult cases, you can call your father. He is a director of Allen College, in London. Yeah.
He comes back. He comes to India once or twice a year, and cases which I feel I'm blocked, I refer to him to see, and he sometimes pulls my ear when he sees I've repeated prematurely or made a wrong prescription. So it always helps to get his expertise. And some cases when I'm stuck, I do refer to him. And again, he's also advocator of comparative mathematics, so he also gives his expertise on cases which I'm stuck as well. So yes, it's always good to have someone to guide you in difficult cases. Yes.
Great. So Saptarshi, I'm very glad we start this journey. We start this cooperation together, and I hope to see you very soon on our platforms and our common activities.
Thank you. Yes, I look forward to spreading the wings of classical, practical homeopathy as well, which I have learned over the generations to different countries across the globe with your help and with your support as well. So we look forward to the collaboration. Thank you.
Thank you. Bye-bye.